Well, meanwhile, a report obtained by Newshub says there are blind spots and gaps in our surveillance of COVID-19 at the border.
It's raised concerns if new variations of the virus arrive here, they could become established and spread in the community without us knowing. Investigations correspondent Michael Mora has this exclusive report.
ESR's COVID lab in Wellington's Porirua. It's the engine room for tracking the virus, but tracking it is dependent on having samples.
If we do have gaps, we could get unlucky in there, Michael. We could actually see situations where a new variant comes in or a new variant develops overseas and we can't see it in New Zealand yet because it's hiding in a pocket where we don't have great surveillance.
And gaps are what we have, according to this report obtained under the Official Information Act. ESR needs a minimum of 10 PCR tests to sample from each DHB per week. The report states failure to hit these targets results in genomic blind spots, and that low sample numbers are making it difficult to predict the size or shape of any wave that might hit.
Because of our gaps in genome sequencing, it could be weeks before we detect something that's spreading in the community in our genomic surveillance, and this, we don't know what the next variant looks like.
The next variant could of course be more severe, but the rate of samples sent for checks varies. Canterbury and Southern DHBs are doing well, sending 177 and 129 PCR tests to ESR every week. Counties Manukau and Waikato are lower down the list, referring 21 and 25 samples respectively. 6 DHBs are not hitting the target. Wairarapa sent just 1. Tairāwhiti, West Coast Lakes didn't do much better. Hawke's Bay and Whanganui sent just 7 PCRs.
For the most part, we've got great surveillance across the country, but there is some patchiness into some areas, and we're constantly working on to improve that.
Analysing a whole genome sequence allows scientists to identify what variant they are dealing with and learn how it functions. You need PCR samples to be loaded into this machine to unravel the information. But in the 2 weeks to June 3, only 57% of PCR border cases were sent to ESR. In the fortnight to June 10, 66% were sent. And in the same period, if you look at the PCRs taken from sick people in hospital, just 32% of samples made their way to ESR. Dr. Gemma Gergen says that must improve.
It is worrying that some DHBs are not referring samples to ESR for sequencing.
The Minister says the system isn't perfect, but it's still helping identify trends.
We are, however, going to try and lift that rate of coverage with the whole genome sequencing.
The report states there's currently insufficient data to robustly estimate the growth of different variants. What is known is Omicron BA2 is the most prevalent, but BA2.12.1 is also circulating, as are BA4 and BA5. And these 3 emerging variants are the ones to watch.
Of those 3, it looks like Omicron BA5 is going to be the one that actually wins the gunfight. Our estimate from our modelling suggests that it will become the most dominant variant in New Zealand, probably in mid to late July.
And that in itself will be a challenge in midwinter. BA5 is more transmissible and better at beating the vaccine.
Well, hi, Michael. Do we know why so few tests are being sent for sequencing?
Yeah, well, the Ministry of Health has just told me that its guidance is that all PCRs are sent for sequencing. Obviously, as per the story, that is not happening at the moment. I spoke to microbiologist Susan Morpeth today, who says some of the reasons are that there's a lot of staff illnesses, especially at some of the smaller labs. Some of them might not have time to regularly be couriering the tests, and that some of the tests are no good because they don't have a big enough viral load. Now, the other issue is that people coming across the border who test positive on a rat are then encouraged to get a PCR. However, most are not bothering to do this. In fact, only a third of arrivals who test positive on a rat are then going on to get a PCR. So what you've got is a problem, a dual problem really, of few people doing PCRs, and when they are done, sometimes they're not being sent to ESR.
Michael, thank you.